We are now live.
We're live? Okay, excellent. Should we start now then?
Yes, yes, sir.
All right, hello and welcome everyone in what we hope to be a very stimulating session regarding challenges and opportunities in conducting biomedical research in Nepal, and for that matter, really most low and middle income countries around the world, as the context is really common for a majority of the developing world. Thank you to our esteemed panelists for making time out of your busy schedule to join us, none of whom will really require any introduction, but we'll introduce you as we go on. As for myself, my name is Dr. Saroj Niraula. I'm a medical oncologist working with Cancer Care Manitoba in Canada, and I'm an associate professor of medicine at University of Manitoba. In my professional life, I treat people with solid cancers, focusing mainly on management of breast cancer. I'm also a researcher. My research focus mainly is in cancer policy, health services, clinical trials methodology, and I'm particularly interested more recently in global oncology, which really is the fact that brings me to this webinar. So it's my honor to moderate this session with you all esteemed guests. I don't want to take a lot of your time from our speakers because they are the ones who will be enlightening us on this topic today. But just to point out that although this is just a 90-minute session, we believe that the consequences are far-reaching, and the guiding philosophy behind this webinar is really to first get a high-level snapshot of the current situation of healthcare in Nepal, and to build ongoing conversation, collaboration, both within and outside Nepal. So now I would like my co-moderator, Dr. Kiran Pandey, to kindly introduce himself and further highlight the objectives of the session, housekeeping, and introduce the first speaker.
Thank you, Dr. Nirola. My name is Kiran Pandey. I am a physician and a researcher. My clinical work is in internal and hospital medicine. My research work is primarily in health services and public health. I do a lot of program evaluation, cost effectiveness analyses, even modeling studies, both in terms of distance and trees and other sorts of models. Again, I want to welcome you to this important session today on biomedical research promotion in Nepal. I first want to start by giving you a brief overview and a layout about why we think this is an important topic to discuss today. Over the last 30 years, we've made tremendous progress in the areas of health in Nepal. We've been able to significantly extend average life expectancy over this period. It's gone up by about 15 years, even while a lot of developed nations have taken about 50 years or more in order to gain similar life expectancies. We made similar progress in reducing maternal mortality, in improving child survival, in increasing access to health services, and especially in expanding access to expanding health infrastructure, including health personnel and workforce. So we come with a tremendous amount of momentum into the 21st century in what is now the third decade of the 21st century. But with this momentum come a lot of challenges. What we've achieved thus far, it can be argued, was built upon a lot of, from a low floor, we've been able to capitalize on what were essentially low-hanging fruits. But in order to be able to carry on with this momentum, we need to sort of up our game. We have tremendous opportunities, but then again, we also have tremendous challenges. We have this urgent need to build a health system that is able to offer universal health coverage to all of our people, and equitable access to care, improve financing mechanisms, find sustainable financing mechanisms. In addition, we also have to find ways in order to contextualize biomedical knowledge creation to our unique situation. Thus far, whatever knowledge needs we've had have largely been dependent or fulfilled by knowledge that has been created in other parts of the world. But increasingly, we will have to start focusing on creating our own knowledge, creating knowledge that is context specific, knowledge that addresses our own problems. But at the same time, we also have this opportunity to really do this because we've really expanded the health workforce that is capable of doing this sort of work. We now have researchers both within Nepal and in institutions all around the world who are doing very exciting and cutting edge research work. At the same time, our economy seems to be in an upward trajectory, which means that there might be more resource available, not only to provide health services, but also to increasing knowledge creation activities. But in order to gain what promise to be very tantalizing opportunities, we need some sort of a plan, a vision, and a strategic roadmap that will take us to that particular vision that we are looking at. In order to do that, we need to start having discussions like these, creating a framework, how we might be able to pull together resources, bring our minds together, and solve problems that are common to us in biomedicine, in public health, in clinical medicine, and in allied areas. So this is the reason why we thought this would be a very important topic to discuss today, and this is the reason why we've put together this session. We are very excited to have you all here today. We have a very exciting and a very cross-sectional set of speakers lined up today, people who are in various stages and trajectories of their career that can draw upon wide experiences and exposures and education, and which I believe will lead toward a very useful and fruitful discussion. We were supposed to have 5 speakers today. Unfortunately, Dr. Sandhya Chapagai, who is an oncologist at the National Academy of Medical Sciences, as well as a board member at the Nepal Health Research Council, could not participate because of some personal problems. Still, we have 4 speakers lined up, 2 panel speakers, followed by 2 keynote addresses. A few housekeeping rules. We have 12-minute allotted for the first 2 panel speakers. The 2 keynote addresses will be about 18 minutes each, followed by, I think we will be left with about 15 to 20 minutes of time for question and answers. We would like to take questions from Facebook and Zoom chat box if possible. We also have some of our own questions that we've prepared that we want to circulate around if that's the need. We also want to start a discussion around coming up with a common framework about a common vision for promoting biomedical research in Nepal. I think Dr. Saroj Nirola in his closing address will also address a little more in that issue. With that, I want to start with the first speaker today. Our first speaker today is Dr. Archana Shrestha. I'll start with a brief introduction for Dr. Shrestha. Dr. Archana Shrestha is an associate professor at the Kathmandu University School of Medical Sciences, Department of Public Health. She also holds an adjunct faculty position in the Center of Methods for Implementation Prevention Science at the Yale School of Public Health. Dr. Shrestha holds a PhD in epidemiology from the University of Washington. She has done postdoctoral research work at Harvard University. Dr. Shrestha's current research activities focus on cardiovascular disease epidemiology, implementation science, and research translation. Dr. Shrestha, the floor is yours.
Thank you, Dr. Kiran. I'm going to share my slides. Okay. So first of all, thank you, Dr. Nirola and Dr. Kiran for this wonderful opportunity. Also want to thank NRNA for this platform. And I'm going to talk about advancing biomedical research culture in Nepal. Just to be on the same page, by the research culture, I am meaning research environment, the research norms, customs, and behaviors that we as researchers hold to operate, to conduct our research in our country in order to get high quality and high ethical standards research. And a lot of my talk is actually based on my own experience. So I gained experience of conducting research in two completely different settings. I worked in the US for about 9 years in different universities, from West Coast to East Coast. So I'm familiar with those cultures. However, all of my field work of research has been conducted in a low resource setting. Mostly 90% of my research has always been in Nepal, few of them in India and some in Mexico. And while preparing this talk, I couldn't help myself continuously comparing the research cultures between these countries. And while I was in the US, it has always occurred to me, like, why US universities are so much ahead in terms of research and publications and making impact in terms of creating evidences and translating evidences into policies and practices. So we always, and then why in Nepal, we always seek for WHO guidelines or like guidelines from some commissions, and why cannot we conduct and bring our own culture specific evidences. So making comparison with within these two cultures, like I've tried to come up with few of the things that I have observed and experienced over the years, and that's what I'm going to highlight today. It will range from me as experience of myself as a researcher and experience of the research environment in these two contexts. So firstly, I really want to talk about harmonized research. So I want to bring up an analogy of a race. So if we are running 100-meter race, and if every one of us is running 100-meter race, we land up at the same point. But research, to my, the way I look at it, is not a 100-meter race or a marathon, it's a relay race. So that's what is not happening in Nepal. All of us are really interested to look at factors associated with health outcomes. And we've been doing, if you look at the research publications from Nepal from the last 10 years, a lot of these research would be factors associated with, of course, we've jumped from descriptive studies, like basic epidemiological studies, to these analytical studies, but I feel like we've stopped over there. We're not relaying. We are running 100-meter race, and all of us are running on our own. So in order to like really carry forward one researcher's work by the other researcher, we really need to create this harmonized research culture in Nepal. By this, I am referring to maybe the role of Nepal Health Research Council or institutional research organizations like academic organizations and non-academic organizations, and even like personal research goals itself. So we're not harmonized and we're not relaying. We are kind of like running on our own. So that's something that has really disturbed me over the years. And I think it's now time for us as in researchers to bring a common voice for our country and really set up a common goal and then work in the different compartments to gain that common goal. Second thing is support for researchers here I have seen is very, very low. A lot of specifically my clinician friends who are interested in research are told by their institutions that the research is leisure activity. Most of them take it as a leisure time activity. And you would not be able to do a quality research with that attitude. You really need a protected time, a protected funding, and administrative support. As a researcher, I should not be asking for quotation to buy a laptop for my research assistant. That's what I'm doing when I'm in Nepal. I'm writing vacancy announcements. I'm preparing budgets, financial statements. So that really is not my job as a researcher, and I really expect that kind of administrative support from my institution or from my group. So really, as in researchers, have not been able to secure this kind of support system to function ourselves as a like a more efficient and more efficient and effective way. The third thing I've really noticed is diversity and inclusion, specifically in terms of gender and minority groups, not just in the research team, but also the research participants, the stakeholder engagements. For example, I was a part of a national level commission, I would not like to name it, last year. And 25 people from all over the Nepal were chosen to be a commissioner member of that committee. It's supposed to analyze data for non-communicable diseases and make a national strategic plan to address NCD problem. And I enter in the hall and all I see are 24 men and only me. It's nothing wrong to interact with 24 men, but I do believe that there are much more capable women or people from other gender who also have a voice and who also are equally competent as these 24 men were in that hall. And couldn't help myself raise that voice, and unfortunately was dismissed. That's a kind of very regular experience that I'm having as a researcher. I'm not speaking that because I am a female, but this is, I don't think I have to explain why inclusion and why diversity is so important. Even after like we've crossed 5 years, our constitution in Nepal has already stated equality in terms of gender and minority groups in all forms of commissions and committees, and why we are still not thinking about it. And that kind of reflects how our society still functions, and that also reflects how our research culture is still functioning. And I see that as one of the major gaps in advancing research. The another major thing is rewarding the quality of research in Nepal. We don't have that system to reward, and I don't mean like in terms of hundreds of thousands of dollars or in terms of kind of medal or something, but we're not appreciated or recognized well enough. And a lot of researchers shy away from publishing on negative findings, and I think that coming back to my relay list, I think negative findings are as important as a positive. Negative by that I mean like not rejecting our hypothesis or something like that. And we're not recognized enough as a researcher if we do a quality research, and a lot of us are really running after publications, a number of publications. A lot of my conversations with my colleagues have been around like, how many publications have you had in the last month or last year or in your lifetime? How many were cited? But that's, I feel like that might be one of the criteria, but that's not all. And we're not talking about how our research are impacting the lives of people, or how we can advance our research methods, or even how can we take forward our research results. And that kind of conversation is really missing in our culture. So really respecting each other's work and like depending on each other's work need to be recognized and to be able to like move forward from the quality product that we create. Other thing is, I already touched upon it, is to move beyond publication and scale up impact. It's been quite a while. Like Nepal and Nepali researchers have been publishing a lot. If you see over the last 10 years, it has alarmingly increased. But there has been a discussion like whether or not we are really publishing what our country really needs. Two things that I want to highlight here is to think beyond publication. We should not be doing any research to publish it. Of course, publication is one of these steps, and to share it with our peers and other people. But really, even before we think about our research question, we need to think about how we're going to use the results of this research, and that should go beyond the publication. And we are here limited with that. And I think we need to create more platforms and more discussions, create more groups to bring this idea forward, to go beyond publication and to scale up our impact and really take one's work and just work on top of it, not like trying to compete or repeat it. Another very important thing that I have noticed is about a partnership in the international research. It's been painful to observe how, I mean, it may not apply to all of us, but even though I don't have a definite statistics, I can say that even like 80 to 90% of our partnership with international research groups has not been, I don't think it's an equal partnership, because a lot of people come with their ideas, we collect the data from them, they take data and then they publish and then they write another grant on it, and that's how it functions. For example, I'm not sure if I should take the names. Hopkins has done a mammoth amount of research in Nepal, but if you look at the publications, even the publications of the research that they have conducted in Nepal, you will only find few of Nepali researchers' names on that. Some of the publications don't even have any Nepali names. Having Nepali name does not guarantee equal partnership. It may be an indication, but we really, as a researcher in Nepal, we really need to be aware of how our partnerships should look like. We should really negotiate with our international partners and function as a partners. So I think this is something that we really need to think beyond and think through and work towards. So this is the last point that I want to make. So I spent 3 years at Harvard doing implementation research, so I might be a little bit inclined to advocate on this, but at the same time, I genuinely feel that implementation research is the way for Nepal. So I mean, our research infrastructure is not that advanced. So let's admit it, we cannot culture COVID-19 virus right now in Nepal. Our lab facilities, our research institutions, the experience in research is not designed for discovery research. Even though I don't have anything against discovery research, of course we should keep discovering things for us, but there are a lot of information, there are a lot of evidences which is already existing in this world that we can use. So for example, if we know that ORT is working for diarrhea, we don't need to invest to develop or discover another ORT. We need to invest to see how we can bring this ORT to each and every household member that has a children with diarrhea. So our research can focus on bridging that no to do gap rather than, would not say rather than, but in addition to discovering new things. So as a researcher, I think this is a new avenue in Nepal that we should really explore. With that, these are the acknowledgements for the pictures that I used. And thank you so much.
Thank you. Thank you, Dr. Asuna. That was very eye-opening, and we will discuss that later. I think we'll reserve the questions for later when all the speakers have had their say. So let's move on to our second speaker today, or tonight in Nepal, I guess. Dr. Bishes Paudel is our next speaker. Dr. Paudel is an associate professor and chief clinical hematologist in Civil Service Hospital in Nepal, where she also supervises FCPS trainees. He has been practicing clinical hematology for more than 13 years now. He pioneered clinical hematology and bone marrow transplantation service in the country. So we should all applaud him for that. And he has earned a lot of respect and name around the world for doing that. He has successfully completed several autologous, allogenic, and haploidentical bone marrow transplantations He has established a hematology-related laboratory in the country and postgraduate program at his hospital. He has special interest in bone marrow transplantation, acute leukemia, aplastic anemia, and hemophilia, and has published more than 30 articles in peer-reviewed journals. So very prolific name in Nepal. So it is our great pleasure to welcome Dr. Paudel to this forum. Dr. Paudel, please. You're muted, Dr. Paudel.
Okay. Hello, am I audible now?
Yeah.
Yeah, you're good.
Okay. Thank you, Dr. Soros, for such a kind introduction. I'm really delighted to be here. So in the coming 10 to 15 minutes, I'll be talking on the barriers and opportunities of clinical research in low-middle countries like Nepal. So the truth is, when we talk with our clinicians, we all agree that we see a huge number of patients. And we also feel very strongly that we need to conduct a clinical research to identify and minimize the cost of the treatment and to plan for a novel treatment in our clinics. But these clinical researches, and why we need to do all this clinical research is just to provide at least a guideline for our healthcare professionals working in environments with limited medical and surgical resources. But the bitter truth is, vast majority of the clinical research continues to be designed and conducted in high-income countries. And to rub a salt to the wound, I should say, the diseases of relevance to high-income countries are investigated in clinical trials 7 to 8 times more often than diseases whose burden lies mainly in low-income countries or middle-income countries. And to add the other bitter truth, only 10 out of 1,556 new drugs produced between 1975 to 2004 were targeting diseases specifically prevalent to poor or low-income countries. So we all agree that research should be done, but we should know that the research is conducted in high-income countries may not be that helpful in our setting. And the reason for that, because I deal with oncology, with the cancer patients, most of the oncological new drugs, the chemotherapy, or whether you call it a biological agent, they are very costly. And most of these trials, they have shown the progression-free survival of only 2 to 3 months. And without any quality of life data, and with those expensive drugs, with the progression-free survival of only 2 to 3 months, I don't think that really is beneficial in our setting. And also, those drugs, most of the drugs, whether that be a chemotherapy, or newly developed chemotherapy, or a biological agent, they come with life-threatening side effects. And many of our scientists over here, they might not be sufficient, or I should say, might not be able to overcome those adverse effects or side effects of the drugs. For example, nivolumab, which is a very well-known drug for melanoma in the West. We have used those drugs in few of our patients in our setting, but when the patient develops side effects of that, especially when neurological side effects or the hormonal side effects, most of us cannot manage those side effects in our settings. Also, the trials that were done in the high-income countries are done in a different ethnic group, and we are not sure whether the drug is equally effective in our population, because there are many reports that the drug in one ethnic group may not work in another ethnic groups. So there are many challenges to conduct the clinical researches or clinical trials in low-income countries, and as the previous speaker has already said, the funding is the biggest hurdle. And most of the pharma companies, they don't believe us that we can run those trials, and they might be true because we don't have expertise in health economics. We don't have the people, well-trained people in epidemiology or anthropology or even in statistics. We don't have people who are trained in managerial skills to conduct clinical trials or clinical research. And also there's a lack of motivation to physicians and researchers, because here in Nepal still today, you are known to be a very good physician if you see 100 or 200 patients a day, rather than doing a clinical research or clinical works. And unfortunately, there is always a lack of role models for the young physicians to whom to look up to, so that they can say, well, you know, that we want to be like him, like a guy who has a lot of researches and who's well known to the scientific community. And the other challenges that we face in our day-to-day practices, there's always the brain drain, primarily due to a lack of opportunity in basic science students, because they don't get the opportunity over here, and they are bound to travel abroad to get to look for the better opportunities. Another challenge that we face while conducting a trial or conducting a clinical studies over here, the ethical concern, because we all understand that when we compare certain medicines, there has to be some standard of care. And whatever is the standard of care in US or in UK, that might not be a standard of care in Nepal, because by that time the medicine is not available, the medicine is too expensive for a pharma to sponsor that. That is one of the most important challenge, I think. And also the other thing is the ethical challenges, just like the quality of informed consent. Here in the lower middle country, there are various reports saying that the people, during the clinical trial, the recipients or the participants are not informed what is going on, what are the adverse effects of the drugs that we are going to take, we are going to give. So a lot of these ethical concerns are also a challenge. And the other important, I think, is a participant recruitment, because here, when we say to our patients that, okay, we want to do a trial, we want to do a clinical research on you, most of them, they think it as experiment. And the experiment in Nepali culture is like, no one wants to do that. No one wants to come forward just to get, to get tested. And the another challenge is like the resistance from the high income countries professional, because everyone when you do a research and you go to a big meeting, and when you present that, they are not taken very seriously, because most of them, they think, well, this was not invented in this part of the world. This was invented in low income countries, and we really doubt how they do that. That is also one of the most important challenges, I think. And the other is the publication issues. Like, there's always a high chance of rejections when you do a research, when you do a study for low-income countries. And publication fees for most of the journals are so expensive that we simply can't just afford that. Having said that, there's still a lot of opportunities. And I think I should say that disease burden is a big opportunity for us. It's not only in the communicable disease, but also in non-communicable disease. And a lot of good studies has been done in Nepal. This is the study that was conducted in Patna Hospital. And this is the study of a typhoid vaccine published in NEJM. There are a lot of jugaad opportunities, and this is one of our papers that we published a long time back in leukemia lymphoma. In the West, people were using liposomal amphotericin B. Here in Nepal, we didn't have that drug. We made our own liposomal amphotericin B in our hospital, and we administered that to our patient, and it really worked very well. And we were able to publish that. And another example is like this was done in teaching hospital recently, where they made an affordable video laryngoscope for the patient who needed intubation. And the cost was the price was very reasonable, and it got published in Lancet Global Health. And when you look for a clinical research or for the clinical trials, sometimes you need to look for simple things. Well, if you want to do a big studies or fancy studies, you might not have enough budget to do that, and people might not support that. But there are a lot of other simple things that you can really rely on, and you can do that. So this is our study that we did recently, and this was published in eCancer. We simply used the Viver app to connect to our patient during the pandemic. No one missed the chemotherapy, and everyone did very well. And this was published very recently. And also, I think there are many relevant things that can be done in Nepal. It's not only about the drug and about the fancy medicine, as I've said earlier. Here in Nepal, we all know that the financial toxicity is a big issue. So most of the patients, they really can't afford the drug. And even if they afford, they might not be able to finish the whole course of medicine, a whole course of treatment. So we sometimes, those smaller, those those low-hanging fruits, I should say, these are all this might trigger a big impact. And till date, in leukemia patient, no one has defined what is financial toxicity. Here in our in our small survey, we're able to define the financial toxicity, and we're able to publish in Lancet Hematology. So it's not only the fancy things, it's not only the big things that you have to look upon. There are smaller things around, and if you can really capture those things, you can publish that, and you can do a good research. And the other thing in low middle countries is like you can use the drugs like I should say repurposed drugs, the drug that was used for one disease that can be used in another disease if there is enough scientific data on that. And this was done by our Indian colleague, where they use a dapsone in chronic ITP, and which really worked well. And now this is recommended. This dapsone is recommended as a second-line therapy for ITP patients. Collaboration is very important for a clinical research or a clinical trial, and I can give you an example for that. When we started a transplant long time back in 2012, well, luckily this got published in British Journal of Hematology, but the impact was very minimal. But when we collaborated with the UIC in University of Illinois at Chicago, and when we ran this program in Civil Service Hospital, then the impact was very huge. And there were a lot of grants coming from different parts of the world. And we were able to do more and more transplants, more and more studies, and more publications. So I believe the collaboration is a very important thing in a country like Nepal to conduct clinical research. And this is for hemophilia again. This is again from the paper that we published a few months back. And till before this collaboration, this is a collaboration with the University of the Rochester General Hospital in New York. Before this collaboration, the arthroplasty, which is so common, the procedure, common procedure done in hemophilia patients in the West, was not available in Nepal. No one was willing to do that because people were, the orthopedic surgeons were very scared that the patient may die because of bleeding. But with the collaboration, we were able to bring them, and then we were able to start this treatment to this procedure in Nepal. And with this collaboration, now the things has opened up, and now we are doing the Rochester General Hospital to introduce us to St. Jude General Hospital over there. And with this collaboration, now we are almost ready to do a clinical trial on gene therapy in hemophilia patient, hemophilia B patient. So I think, and the collaboration is not only for a low middle income country. This will help the high income countries also. And there are a lot of publications about that, and the studies has shown the trial conducted in low middle income countries, and plus the high income countries tend to be of better quality than high income countries alone. Having said that, however, I should stress the researches or the clinical trials done in low-income countries should address a question of important clinical need in the society or in the country. It should be a cost-effective intervention, and so that everyone can afford it, that is affordable to everyone, and should be easy to conduct with the settings of standard of care. Thank you for that. I think I was okay with the last slide. And conclusion is the clinical research is feasible in Nepal. We should explore funding opportunities nowadays. There are a lot of opportunities, especially for oncology, ASCO, ISMO, and other things. And we need to we need to turn the challenges into opportunities, and we need to build up the team and collaborate with the leaders in the field. Thank you. Thank you very much for your.
Excellent. Great. Thank you, Dr. Paul. That was fabulous. And we'll reserve the discussion at last, as I mentioned earlier. Now, let's move on to our two remaining speakers, who also happen to be our keynote speakers. We'll be starting with Dr. And we have not just us, but the whole country has benefited a lot from their experience, from their knowledge, and we're very fortunate to have them on the stage today. We'll start with Dr. Anjani Kumar Jha, who is the sitting chairman of Nepal Health Research Council. He has been serving in this capacity for the last 4 years. Dr. Jha is a radiation oncologist by training. And prior to this, Dr. Jha served in clinical and academic capacity at BP Kerala Cancer Hospital and BP Kerala Cancer Hospital and National Academy of Health Sciences, as well as the Patton Academy of Health Sciences. He's also a past president of Nepal Medical Association. Dr. Jha has worked in advisory roles in Medical University Probability Study Committee and the Medical Sciences Subcommittee of Nepal Academy of Science and Technology and the SARC Federation of Oncologists. So a lot of hats that Dr. Jha has worn throughout his career. And as a representative of Nepal Health Research Council, we are very glad to have him on the stage and hope to benefit a lot from his talk. Dr. Jha, the stage is yours.
Okay. I'm audible?
You are, yes.
Yes. So thank you very much, Dr. Saroj and Kiran, for giving this opportunity and including the Nepal Health Research Council in this platform. So namaste and good day. So first of all, I wish a great success of this second Global Nepali Health Summit. You have done the very good job. Fortunately, today we have our former chair, Dr. Maske, and he has done a lot in Nepal Health Research Council and other speaker as well, Archana. So today I am going to discuss about the Nepal Health Research Council activities. So my presentation outline will be the overview of the health research governments in Nepal, COVID-19 research being conducted by Nepal Health Research Council, finding of some research studies conducted by Nepal Health Research Council, challenges on health research, opportunities on health research. So, Siddharth, so as you must be aware that Nepal Health Research Council established around 30 years ago by the Act, and the Parliament has the Act that Nepal Health Research Council, and is supposed to focus on health research and keep on increasing the number of health institutions and health workers in order to make health service widely available and qualitative. This is the organization, especially the politician, they have given the mandate to the Nepal Health Research Council hereby to establish, to do or cause to be done high-level studies and research work on health. And so the Nepal Health Research Council, in the summary, they have the 4 main jobs. That's the health research regulation, capacity building in health research, evidence generation for health, promoting use of evidence, and to develop the research culture in Nepal. So the Nepal Health Research Council is the major job is give the ethical approval and monitoring of the research projects to be conducted all over the countries. The National Ethical Review Board is within the Nepal Health Research Council, and it is independent. And as the Nepal Health Research Council Ethical Review Board is now accredited by FORCAP, which is the international accreditation body supported by WHO. So now in our ERB, we have constituted to maintain everything like gender biasness, age, and the experts. So the ethical review board, it takes some time, but they are doing the job as per international regulation. And now there are a lot of academic institutes and hospitals. They are engaged in research, and it is not possible by the central body to control everything. So now we have started to give the institutional review committee, and right now there are 51 institutional review committee, especially in the academic institute and the hospitals, those who are interested in the research. Siddharth? Siddharth, next. Next. No. Just. Backer. Okay. So this is the, if you see the graph from 1991, so in this 2018, there are 812 researches approved by the Ethical Review Board, and in 2019, till date, around 1,000 research proposal has been passed through. And if you include the proposal from all of the IRC, it is total around 2,000 proposal has been get through from the board. So gradually the research culture in Nepal is increasing. Well, I am a bit optimistic. So this is the situation. You can see that how the research proposals and research are going on in Nepal. So next. So the next job of the Nepal Health Research Council is to develop the priorities. Last year, we have developed the priorities in coordination with the Ministry of Health and stakeholders, update the National Health Research Policy and Strategy, conduct and promote primary research on national priority areas, collaborate with other stakeholders to generate evidence, national priorities areas, and also the research grant. For last 3 years, we are providing the research grant to the PG students, and as well as the 7 provinces for the researchers. It is not a big amount, but we have started and continuing to providing the grant, because this is one of also the financial things is important, and Nepal Health Research Council, with the support of Nepal government, trying to support the researchers. Next. Okay. So there are some major researches which has been done in Nepal, that is non-communicable disease, with the support of WHO, the NCD STEP survey we have completed last year. Similarly, the first time we have done the National Mental Health Survey and we are going to disseminate this survey day after tomorrow. So this is a great achievement, and it's quite expensive, but our health ministry and has supported, and we become able to now complete and going to disseminate it. Similarly, we have completed the population-based cancer registry. So we are 3 oncologists in today's program, Dr. Saroj and Dr. Bises and myself as a radiation oncologist. So hospital-based cancer registry has been started in 2003, but population-based cancer registry, it was a bit difficult to start, but Nepal Health Research Council has completed the population-based cancer registry 2018, and we have already disseminated this job. Similarly, the DLI verification for Ministry of Health program and project, COVID-19, which is affecting everywhere, and Nepal, we are also in this pandemic situation, and Nepal Health Research Council is trying to do some of the research in this COVID. Similarly, the climate changes and health, air pollution and health. Siddharth. So like the promoting the use of evidence, this was also the challenge that we are doing the research, but where to disseminate and how to disseminate. So Nepal Health Research Council is having the journal. It's a peer review. It started in 2002. Similarly, we organized a summit. So the date 10th, 11th, and 12th April is a fixed date for the summit where the most of the researchers and scientists, they gathered and they present their presentation, which is very useful, and we have completed the last 6 summit. So similarly, the conference, seminar to disseminate the workshop and interact the young researchers with the senior peoples. Database of peer-reviewed publications, development of the policy brief we have started, because we do the research, but ultimately it has to go to the bureaucrat and the politician. They don't have that much time. So we started to a one-page brief of all the researches and to submit to our health ministry to implement it, because ultimately they have to implement. So that is one of our job. Similarly, the Nepal Health Research Council representation as a member of different steering committees and TWG meetings. So this is the summit declaration. At the end of the summit, we used to give the declaration. It's the usual practice. And last time also we have done the 6th declaration. I'm not going to read this. You can see. Similarly, regarding the COVID, everywhere the discussion is going on, and Nepal Health Research Council was also involved in this WHO headquarter meeting in 11th and 12th February, and they have given the priorities, 9 priorities. And as per their recommendations of different 9 recommendations, we have also prepared the priorities as per global priorities like the virus, the animal and environment, epidemiological studies, clinical characterization and management, infection prevention and control, including healthcare, workers protection, candidates, therapeutics, candidate vaccine, ethical consideration for research, social science in the outbreak response. And there are so many papers the peoples have submitted in Nepal Health Research Council, and all this paper, it has been already cleared by the Ethical Review Board, and studies is going on. Similarly, the Nepal Health Research Council themselves involved in around 22 researches related with the COVID-19 as per the WHO, and we fix up the priorities. These are some of the studies which is going on by the Nepal Health Research Council. And now the opportunity, Nepal Health Research, Nepal government of Nepal budget on health research has significantly increased over the years. External development partners, including WHO are allocating more resources on health research. Both national and international collaboration on health research increased over the years. For the international collaboration, Nepal Health Research Council has the rule that now any international researchers, if they want to do the study in Nepal, they have to fix one principal investigator from the Nepal. They must be Nepali, and he will be the corresponding PI. So now if any studies in Nepal if any publication, Nepalese researchers must be included. That is the rule. I was listening to the Archana's presentation that there are studies and no Nepalis are there. But for last 3 years, as per this rule, if any studies, any collaborative studies in Nepal, Nepalese people and researchers must be involved. Similarly, the Nepal Health Research Council increasing their horizon, trying to include the academia in the research. So we have signed the MOU between Tribhuvan University, Kathmandu University. ICMR they're supposed to sign last week, but due to some technical problem, it has not signed, but in future we are going to sign. Similarly, the Edson University, China, University of IHME, University of Washington, USA, Goethe University, ITM Belgium, NAMS, Bir Hospital, BPKM Chiton, Syed Gangalal, Heart Center. We are trying to include the more the academia. Now the challenges, though we have the 30 years history, but in last few years, our peoples, they have inclined toward the research. So still we have the problem like the research infrastructures, laboratory, retention of trained human resources, research culture just for promotion. So research just for promotion means that in Nepal, if you are working in any academic institute, then to be an academic position, you have to publish the article, and for that purpose, some of the people, they just involve themselves and they quit. So lack of committed funds for the prospective studies, lack of trust of study, teamwork, poor culture of data sharing. So these are the challenges we are facing. So thank you very much. And I appreciate if any queries about the Nepal Health Research Council. Thank you very much.
Thank you. Thank you, Dr. Jab. That was a very thorough presentation about what the NHRC has been doing today and what the current challenges are and where we stand as a nation in terms of research. And that brings on to our final speaker, our second keynote speaker for today, Dr. Mahesh Kumar Maske. Dr. Mahesh Kumar Maske is the founding chair and the executive chief of Nepal Public Health Foundation. Dr. Maske is a prominent expert in public health, health policy, and planning, with experience working within the government, academia, and in international diplomacy. Between 2006 and 2009, he served as executive chairman of the Nepal Health Research Council. During this time, he was also the advisor to the Honorable Deputy Prime Minister and Minister for Health and Population, Mr. Amik Serchan. In addition, he was the chair of the High-Level Health Policy Advisory Committee of the Ministry of Health. Among Dr. Maske's important policy and program contributions during that time include the implementation of targeted universal free health care services in public health institutions in Nepal, the drafting of the 3-year interim health plan of the government of Nepal, and the implementation of the 2-year public service program for medical officers. Between 2012 to 2016, Dr. Maske served as the ambassador of Nepal to the People's Republic of China, a period in which, among other things, he prioritized international health diplomacy. Dr. Maske, the floor is yours.
Thank you, Dr. Pandey. Dr. Nirola, distinguished speakers and participants. It is my pleasure and honor to be invited in second NRNA Global Health Conference to share my views on opportunities and challenges of health research in Nepal. I had the benefit of listening to the distinguished speakers and agreeing with most of the points made by them. I shall try to dwell upon some areas which I feel important for advancing health research in Nepal in current scenario. When I try to reflect upon challenges and opportunities of health research in Nepal, 3 interrelated elements come to my mind. First is the understanding of the common thread that runs in...
Do you have a PowerPoint?
No, I don't have. I'll just
okay,
speak.
Okay.
Just like a keynote speech.
Yeah.
Okay. So when I try to reflect upon challenges and opportunities of health research in Nepal, three interrelated elements come to my mind. First is the understanding of the common thread that runs in all scientific research, be it clinical biomedical, public health, or qualitative socio-anthropological research. This is logic of science. The context, design, or the approach to data analysis may differ. Second is the contemporary and practical determinants which facilitate, hinder, or impair the conduct of health research, the most outstanding being research ethics and international collaborations. Third is the translational dimension of health research, the research policy nexus translating research outcome into policies and their application through implementation embedded research, feeding again into policies in a cyclical manner for continuous enrichment of evidence-based policy formulation. All three are important and operate holistically. The second and third has been sufficiently deliberated by Dr. Archana and Dr. Zaya, especially commend Dr. Archana, who has given a comprehensive overview of research culture, its challenges, difficulties, and Dr. Jha, who has elaborated all the health research governance in Nepal. So these two perspectives has already covered my second and the third points that I was thinking to talk about. So I won't go into that much, and I will concentrate on the first. But before I do that, let me recall the aims of 2030 Sustainable Development Goals, which is to end poverty, to protect our planet, and to ensure prosperity for all. So now COVID-19 has put before us urgent challenges, and the whole world is adapting to a new normal. A paradigm shift may be happening right before us and influencing the priorities of health research also. One of such challenges is that science has to think not only how to deal with problems at hand, but also how to prevent from one happening. So long as nature is exploited mercilessly, wildlife habitats destroyed, and wild animals commercialized, new mutant viruses will continuously emerge to infect human population. And world will have to continue to deal with epidemics or pandemics of diseases X. The COVID-19 is only one such example. In view of these developments, the role of Nepal Health Research Council and Ethical Review Board with institutional review committees in facilitating and regulating health research within Nepal and fostering research collaboration with other countries acquire paramount importance. So some priority areas being like third phase clinical trial has become very urgent in Nepal for vaccine and drugs both. Exemplar studies, I'll say Nepal Public Health Foundation has done 2 exemplar studies, and in spite of all the difficult situation in Nepal, we still managed to become exemplar in the world. And just recently, Bill Gates has brought out a small video, and it deals with the study that we have done and stunting reduction in Nepal as an exemplar. So then this implementation embedded research, which is also very much highlighted by Dr. Archana. And that is what I also think, immediately those new discoveries, which are very useful and accepted by global community, especially WHO, can go through an implementation research in Nepal. And, that is something where our focus should be. And also, I think we have a treasure of Ayurvedic and other alternative medicine, which needs a rigorous, trials to substantiate its usefulness. And that is where also our Western scientific mind may help them, our Ayurvedic colleagues and alternative medicine colleagues, to make a sense of their, medicines, traditional medicine, whatever. We know that artemisinin in China, that was a traditional medicine. It has become a very successful anti-malarial drug out of such kind of trials. which could validate its usefulness. So the health scientists also have to be aware. Yes, he told me about international diplomacy. I think it is becoming a very, very important area, the science diplomacy, the health diplomacy. And therefore, health researchers has to be, one dimension, they have to be open towards this also. So it is not only science for diplomacy, but diplomacy for science also, and science in diplomacy. All the three dimensions are there. And what basically it says is that science has a role to improve the international relation, the bilateral relation between the countries, and therefore it can do a lot, in making the two countries better in their relations. So this is something we need to, for example, let's say this, China has recently announced Health Silk Road, and through that, a lot of cooperation in health research, the space is open for that. Similarly, India announced a STARK COVID cooperation. So this kind of thing are especially for Nepali diaspora, because they are well placed to contribute in international health collaboration. And our government, universities, and research institutions should prepare themselves to harness this potential. Let me come back to the first topic, not only because I think this is of foundational importance, but also because it usually appears to receive less attention, the logic of science. A vast subject, but I'll just touch upon it in the remaining 12 minutes or so. So in this age of information technology and big data, a researcher is continuously exposed to new and old information. She or he also has to make sense of raw data that is collected primarily from her research and processed into a meaningful information so that useful inference could be done, if possible, a causal inference. So this is something, when I was a young research aspirants following epidemiology, and then I had some practical experience, and I was trying to make sense of the research that I've been doing. And then I came across that unless and until I know what I'm doing, I mean, there are so many issues in which we have to be aware in order to make a proper inference. And it is so much interrelated with philosophy of science. Otherwise, we'll be swamped by all these technicalities, statistical jargons, and probably will not make sense of what we're doing. Therefore, my focus for today's talk is just to have a sense of, what that may be, the logic of science. So we all know formulation of the null hypothesis is based on well thought out research question that tested to see whether it is rejected or not. If it is rejected, then alternative hypothesis is accepted. All the research designs and statistical method analysis revolve around this procedure. But then the researcher needs something more to make sense of her work and relate it with other works of similar subjects. The more is the logic of scientific research. Inductive, deductive, and probabilistic logic, which all human beings use as a common sense, but scientists apply with special rigor. In a way, it is being aware of how mind does reasoning and reach to the conclusion and also change opinions. For a long time, this logic was predominantly deductive, articulated in famous Aristotelian syllogism. So if you see a bird in a tree, then you can declare that it flies without observing whether it flies or not. This is the classic example of deductive logic, which derives from a major premise or general principle that all birds fly, and the minor premise that it is a bird. So based on these two premises, we conclude that this bird must fly. So it sounds surprisingly simplistic today, but it remains unchallenged for thousands of years. And with some modification, it is still useful and in good practice. Medical doctors know very well how they use this kind of logic in diagnosing a patient and sorting out differential diagnosis using the information in the standard textbook as the major premise. If a patient comes to you with a dry cough and fever more than 2 weeks and is sputum positive for TB bacillus, then you have no hesitation to diagnose him as TB patient using this deductive logic and without further test. The major premise here being that all patients with the history of cough and fever and a positive sputum are TB patients. So from that, you just derive deductively and say this is a TB patient. But though Aristotle is much credited for this kind of deductive logic, Nyaya Sutra logicians under Akshapada Gautama were developing an elaborated 5-step syllogism, perhaps much before Aristotle. In contrast to the usual cause-effect sequence, they considered effect-cause or karya-kartabya to be the proper sequence for an argument. So for them, the above example would be restated, which start with the effect or conclusion or prediction. This bird can fly. They would start like that. Because the bird has wings. Now, major premise comes. Whatever has wing can fly. As in the case of an eagle. Then this bird has wings such that it can invariably fly. So it follows that this bird can fly. So this is a 5-step syllogism, and it is more comprehensive than Aristotelian logic because it not only says bird can fly, but it also points out why a bird flies, showing the wings and its condition. But then question arises, how did we come to this general principle or premise that bird fly, or whatever has wings can fly? How did we come to this measure from where this deductive logic is drawn? So this conclusion must have come only after a series of empirical observation of flying birds and validation, and then generalizing it to the major premise. So this is inductive logic. You observe, you collect data, and then you make a general statement, and that is an inductive logic. So we had a deductive logic, and then we have this inductive logic. And therefore, an integration of inductive deductive logic what propelled science for another century or two. But there is a catch. We know that all winged birds do not fly. So if you only say all birds fly, and try to deduce from there, you have a problem there. So observing a number of birds flying and generalizing this knowledge to all birds fly is difficult to verify. Induction logic was severely criticized for this, particularly by Karl Popper. Better alternative was to falsify the statement itself. So you cannot prove, you may watch for thousands of birds and then make a statement that all birds can fly, but you can never prove it because you have not collected each and every bird in the world. That was the argument of Karl Popper. But it is easy to reject it. If you could find only one bird that could not fly, then the all bird fly premise will be thrown out. So that is the rejection strategy. So he came out with what he said is the falsification theory. It is difficult to verify, but you can falsify. And therefore he said that science advances through conjecture and refutations. So he said that. So even now, Karl Popper is one of the very well-known philosophers of science, trying to make sense of all these things that we're doing, and all rejection of null hypothesis and all this also comes from his assertion in a major part. But he also had a problem. The Popperian refutation also had a problem because such refutation is possible only when the major premise is absolute. When it is all bird fly, then only you can reject by a single evidence which goes contrary to it. And it also has to make a verify. If you have to say all bird fly is refuted by a presence finding of an ostrich who cannot fly, then you have to verify this ostrich is an ostrich. So you cannot say verification is impossible. So this kind of contradiction, Karl Popper is also going through. I mean, his thoughts is no more, but so here comes the probabilistic logic. So it is in nature, we don't claim that all is this, all is that. What do we do? It's most probable. Maybe most of the bird fly, and you are safer that way. You know, you are more polite, more humble, and more safer that way also, more close to the nature. So a better formulation for major premise should include this uncertainty, because there's an element of uncertainty. This element of uncertainty is in physics, is in health, is in biology, and therefore in logic also. And when this kind of element of uncertainty is incorporated in logical science, then the probabilistic logic becomes much more useful. And therefore, what we are doing all this, I mean, then when we look at the bird, then we don't say, oh, this bird flies, but we may say, okay, this bird is most likely to fly, or it's less likely to fly. You know, that sort of sense of what kind of weightage you give to your prediction, that is much more closer to the truth. And how confident you are in making that statement, you know. You may be very confident. You may say, I'm 90% confident that, you know, this bird may fly, or you may say, I'm not very confident. So this sort of thinking, you know, which has been incorporated in present-day science, if we understand that, probably then we can make sense of all these kind of statistical jargons that we go through, and try to make sense of the confidence interval and p-values, and, you know, different kind of numbers between the confidence interval, the possible numbers of the effect size. So all these things comes from a probabilistic logic. Now, lastly, what I want to say about that is we need to deal with our biases also. And here, you know, it leads, we don't do research in vacuum. We already have certain prior conception, which is called a priori, you know, and therefore we may hold it very much, and we may resist not changing that kind of belief, which may give rise to biases also. So here the Bayesian approach very much helps us of relative probability. And I mean, I just want to mention its name so that you can later on check with that. And the whole process of science is also, you know, changing our own opinion, the changing of the opinion of the researcher, the changing of the opinion of the scientist, so that you can move from one paradigm to another paradigm. So here I'll just stop about the probability stuffs and logic. But what I want to say is that I also want to acknowledge the importance of imagination, flashes of insight, and accidents and discovery. A discovery is said to be an accident meeting a prepared mind, said Alexander Sergi. Said Albert Georgi. And I think an informed, logical, probabilistic, and curious mind is the best approximation of such prepared mind. So I thank you all once again for giving me an opportunity to share my views. And I want to close my speech with a rejoinder from Louis Pasteur. In a large reception where he was guest of honor, someone asked Pasteur, "Isn't it extraordinary these days? How many scientific achievements are arrived at by accidents?" "Yes," replied Pasteur. "It is really remarkable when you think of it. And furthermore, did you ever observe to whom this accident happened?" Thank you very much.
Thank you. Thank you, Dr. Maske, for such an insightful talk. I think we're almost at the end of our time, and there will be other sessions coming. So I think I think I'll just summarize. So, wow, that was really a remarkable session. This was an extremely resourceful and fulfilling to learn just in 1.5 hours. And our speakers have made me feel that I've been learning this forever. Anyway, so what I'm going to do is I'll probably just quickly summarize what was the take-home message from this session, and if we have some time, we may be able to take a couple of questions. So we started with Dr. Archana, who did a great job of comparing and contrasting research between the two halves of the globe. She highlighted the dependency on research conducted in high resource setting. She highlighted the need to harmonize research culture for a common goal, from person to institute to nation. She also indicated the lack of research support. Currently, research is taken more as a leisurely activities, in other words, no protected time, funding, less intellectual value. She also touched on important topic of gender inequity, which unfortunately still exists in this globe, particularly in the Eastern world, as we all know. She also touched on the lack of reward. She finally also educated us about the measure of research success, which really lies beyond publication and should really focus on the importance of the work. She also touched on unequal partnership when collaborating with international community, and highlighted the need for implementation research. That was our take home from Dr. Archana. Dr. Paudel spoke next, and he started by highlighting research to uplift clinical care, the need of research to uplift overall clinical care. He reiterated the point raised by Dr. Shrestha, that vast majority of research is currently happening in high-income countries, and the lack of, say, cross-societal or cross-ethnic, cross-geographic generalizability of research. Again, the funding remains a problem, which he also highlighted. He touched on financial toxicities of cancer drugs, and touched on a few opportunities that exist in low-income countries, which we should cash on. Dr. Jha similarly provided a very nice overview of the history, context, and scope of NHRC, provided a snapshot of increasing research culture in Nepal, talked to us about ongoing research activities, including in COVID, and highlighted the challenges like infrastructure, human resources, and lack of trust and teamwork. Finally, Dr. Maske, very elegantly provided us with the concept, the overall concept of research. He highlighted the need to link Nepali research to international priorities, build on local opportunities like traditional medicine such as Ayurveda. Also gave a very important insight of using science as a tool to strengthen international diplomacy. And finally, Dr. Maske very interestingly illustrated his first pillar of research, which is the scientific hypothesis, with the grand philosophical review, where he really highlighted flaws in human reasoning, in my opinion, focusing on cause-effect connection, with example of deductive logic, effect clause logic, falsification theories, probabilistic theory, and finally coming to Bayesian theory, which is commonly used in contemporary medicine, and that really relies on assumption that future probabilities depend on past knowledge of things. So we might be able to take a couple of questions. I am just trying to look here if there is anything in the chat room. I don't see any, and not in Facebook either. Probably what I might start with is a couple of questions for Dr. Jha, actually, because Nepal Health Research Council really is pivotal in whatever happens in research in Nepal. So this program is being seen by a lot of, and will be seen, the recorded version will also be seen by a lot of people, Nepali diaspora, who may be wanting to connect to Nepal in terms of health research. So if you'd just like to enlighten us on, what are the areas of need, how people like ourselves living outside the country can join hands? What is the avenue? What is the area of need that you can use our expertise? And really, what do you see as the future direction of NHRC? Do you and you did express your satisfaction about what is happening there, and it was encouraging to see so many research activities going on. Where do you see NHRC in, say, next 5 years or a decade? Just a couple of questions. If you could be short in your answer,
well, thank you very much. Nepal Health Research Council, administratively, we are thinking to expand the Nepal Health Research Council in different provinces. So that is the administrative things, and we are working on it. And our team, they are talking with the Ministry and Government of Nepal to expand the branches of Nepal Health Research Council, so that outside the valley, the people, those who are working in different institutes, they will be acquainted with the research activities. Regarding the people like you who are in abroad and want to do the studies in Kathmandu or Nepal, so if you go in our website, if you see, we have fixed the priorities areas, and of course, right now everybody is involved in COVID, and as Archana was mentioning, that we are not prepared for such type of discovery research. But so in fact, Nepal Health Research Council, they are looking for the collaboration with the different institute or the individuals, those who wants to do the research in Nepal. So the collaboration window is always, the door is open, and anybody can do the research. That one part is mandatory, that if you want to do the studies, you have to fix up the one of the PI in that proper subject. So that is mandatory now, and that is not a big deal. We will cooperate you. We will give you the address or the ideas who are the researchers, and the peoples are really interested to work, because in the people like you, those who have gone to abroad, they are doing so same way. Some are the peoples, they are here in Nepal also, and they want the collaboration. So you are always welcome. And the financial part, I am in the research council, and that is not a big deal, because the government, they are really interested to support. And in last 3 years, we spend million and million to do the national health the survey type of research, whether it's a step survey or it is a mental health or the cancer registry. So somehow we become able to manage the financial part. So I request the technical person or the researchers, those who are in abroad or in the Nepal, they should have the very good proposal. That proposal should help the people of the Nepal, and that will help the policy for the government. If such type of research, and if anybody is interested, we welcome them. So anywhere, anytime. And now the most of the thing in Nepal Health Research Council, everything is online. You can submit your proposal, online submission. You don't have to come to the Nepal Health Research Council. And so we can work together. And I appreciate if anybody wants to do the studies, we are always there to support.
Excellent. Thank you, Dr. Jha.
Anything else you want to?
Dr. Pandey, do you have anything more, any questions or anything before we conclude?
No, I think we've sort of overstepped.
Yeah. Dr. Maske wants to say something. You're muted, Dr. Maske.
I just wanted to add on what Dr. Jha said. What I think is that, now the Nepali diaspora of scientists is increasing quite impressively. We need to have a policy, Nepal Health Research Council, Health Ministry, and NAST, National Academy of Science and Technology, to bring that resources together. And I raised this issue of science diplomacy and health diplomacy. So until now, what is happening is that universities or research institutions or individual researchers are trying to have these collaborations, from their own effort. So that is fine. But then this science diplomacy urges that this has to be raised. This kind of collaboration has to be supported by the government, okay? So that they can have and their opportunities should be expanded, given if the diplomacy is coming forward, just like Health Silk Road, then the government should be able to bring in the Nepali diaspora of scientists to engage in that, So therefore, I think it would be much better if Nepal Health Research Council will have a dialogue with Nepal Academy of Sciences and Technology and see how this can be furthered. That is my suggestion.
Excellent, thank you. So I think we have to conclude. So it was great having you all, and as I had indicated in the beginning, this is we wanted to use this forum just as a start to build up more collaboration. I hope the conversation will continue. We also hope to, as I indicated, come up with some document, and we'll all need all of your input. Once we have the first draft of the document, we'll circulate, and we would very much appreciate that. So finally, on behalf of the organizing committee, I would like to offer greatest. Thank you, everybody. Great.
Thank you.
Thank you.
Thanks. Good night.
Good night.
Thank you.
Good night.